All right. So, okay. Can you see the correct view? Okay, perfect. All right, so I am just going to quickly go through a couple updates with all of you today so we can get to the rest of our agenda. So I wanted to mention that this is a little ways off, but I don't know that we'll have another collaborative meeting before this time, but our next Mother Infant Health and Equity Collaborative meeting is May 19th. It will probably still be a virtual meeting at this point. These are our quarterly meetings that are open to all anyone interested in maternal, infant, family health. And so we hope that you will join us. Registration is required. It's free, but we do need you to register so that you can get the link to access the meeting. And so I've linked them here in the slides. I will send the slides to Elena to share with everyone so that you'll have the slides. You can just click on the link and you'll be able to register that way. So you'll get the link to access that. Also a reminder that our 5th annual Maternal Infant Health Summit is coming up. It's scheduled for June 21st and 22nd. It will be a virtual summit again this year. Hopefully next year we'll be able to be in person. But this year we are going to do a virtual format again. So we are hoping registration will be opened towards the end of this month. So as soon as that information is available, I will make sure that it gets to Elena and gets out to everyone. If you are interested in attending, it will be great. The agenda should be released soon as well. We have a lot of great keynote speakers and breakout sessions. So hopefully you find it all really interesting and beneficial. We have released exhibitor and sponsor information. And again, that's linked here on the slide. But you can also go to myhealthsummit.com and you can find more information, including that exhibitor and sponsor information, if that's something that you are interested in. And then a reminder that if you don't already receive our emails, which I know usually get forwarded from Elena, but if you'd like to receive them directly yourself, and then you might end up with duplicates, but that's okay, right? So you can sign up to receive these emails. Again, I've provided the link, and then also a reminder about our Division of Maternal Infant Health webpage. And the link is there as well as our actual web address. And then I just wanted to share a couple of resources with everyone in case you haven't seen these yet. March is actually Women's History Month. And the theme is providing healing, promoting hope. And this is meant to be a tribute to, is both a tribute to the work of caregivers and frontline workers during the pandemic, and is also a recognition of the many ways that women of all cultures provided healing and hope throughout history. So I provided several different links on this slide, so you can visit, you can hear, you can read about stories, untold stories of public health heroines. You can read about the history of women's health or Women's History Month, Michigan's Women's Hall of Fame. And then there's also some really interesting information about 3 individuals who are being called the mothers of modern gynecology. And so there's some articles as well as a short video and then some follow-up information in that final link there. So some things you might want to check out there. Also, there is a video related to Black infant mortality rates. This is a really quick video. It's about 6 minutes, and it starts to kind of get at those root causes of racism and some of the effects of racism on birth outcomes in the United States. The video highlights Dr. Renee Kennedy's lived experience, and Dr. Kennedy is She is, I believe, the CEO of Michigan Public Health Institute. So someone local from the state sharing her experience. So it's a great video, and I encourage you all to check that out as well. And again, another video. This is racism and health in US medicine. It's also, this one is about, I think, 30 minutes, maybe a little bit less. So again, not really long video, but it is really impactful and really interesting. So I also encourage you to check that out. And then I wanted to share with you that the ACOG practice advisory has been updated. It was last updated March 2nd, so just last week. And this is with vaccination considerations for OB and gynecologic care. So there's some new data that is referenced in the updated practice advisory. So if you're looking for some additional information, this is a place that you can go to find that. And then finally, in case you haven't seen this, there's also been a small study by JAMA that suggests that vaccinating pregnant people against COVID in mid to late pregnancy can provide some protection to the infants through 6 months of age. And so I've linked that to the link to that study on here as well. And so that is actually all I have for today. Here's my contact information. Again, our division website. If you ever have any questions, you're welcome to reach out to me. But if anybody has any questions right now, I'm happy to take those as well.
Hi, this is Keena King from Berrien County. Will these slides be available? Because I wanted to go back with some of those resources. Are you guys emailing these out?
Yes, I'll send them to Elena and she'll send them out to everyone. Yep.
Thank you.
Sure.
Any other questions for Emily? Okay, do you see the right slide, no notes?
Yes.
Perfect. Thank you. So I will jump in and share some things that SWMPQIC is currently working on for our quality improvement initiatives for this year. Some of these are going to look familiar to you. So the free virtual childbirth education classes, along with the free breastfeeding education classes, both virtual opportunities we did last year as well. Those started in response to COVID. But we are continuing them through this year because they've been really well received. And then we have two kind of new things that we've tried out this year, one of which is a doula pilot. So we're starting something on a small scale. And then also looking at immunization funds. So I'll talk about each of these individually for a little bit. So our virtual childbirth education classes is a series of 3 1.5-hour classes that are virtual. They are on Zoom. These classes are instructor-led, and so we have a certified childbirth educator who runs these classes. They're typically small in size, ranging from a couple participants to about a dozen who join. The response to the childbirth classes has been really, really positive in the past. We've had really great feedback through evaluations. And anyone who attends all 3 of those classes and completes our quick evaluation gets a $75 Visa gift card for attending. So we actually have our next class starting this Saturday, so it's not too late to sign up. You can visit the link on this slide, and I will send these out as well to go ahead and register for March's class. And then we'll have April through kind of the rest of the year scheduled and send those out to everyone when it's confirmed and ready. So going on to our breastfeeding education class, Bianca Nash-Mio is a certified lactation consultant, and she teaches our breastfeeding classes. Those are also virtual, but they are a one-time 2-hour class. Anyone who attends that and completes the evaluation gets a $25 Visa gift card. And we typically have these classes hosted about twice a month. So There is an upcoming class as well tomorrow. It's not too late to register for that one. The link is here. And we also have another one coming up on Sunday as well, on the 27th of March. So new to SWMPIC this year is our doula pilot. So we are testing on a small scale, having doula services be provided to 5 women in Region 8 this year. So those doula services would include 2 prenatal visits with the doula, the doula attending the birth, and then 2 postpartum visits as well. So right now we have an application out, so you can see the link on the slide to that application. We have a scoring rubric that we use to make sure that we are avoiding any sort of bias in selection. And those who are selected get paired with a certified doula to be able to provide some of those services because we know that doulas help improve birth outcomes. So we currently have one mama who has used the doula and given birth. We have another who is in the works right now getting her prenatal visits, but we also have 3 spots still available to this. And if you know a doula who would be a good fit to help support these services as well, please feel free to reach out to myself. And then again, new this year is our work around immunization. So SWMPIC accepted $70,000 to be used between this year and next to help increase vaccinations for those who want them for both COVID vaccinations and also for vaccinations in the maternal infant population that may have fallen behind due to the pandemic. So the areas that Region 8 selected and want to focus on is really being able to gather information from the community to help understand vaccination efforts and those barriers that people may be seeing. We also want to leverage partnerships with those who already have trust established within the community to help educate and increase vaccinations. And then also utilizing our existing social media accounts to help with outreach and education. So if you notice, if you've gone to our Facebook and Instagram, we have been sharing some reputable vaccine and education on those sites. So that's kind of a high level, quick overview of what SWMPIC is working on this year. The vaccine panel and COVID panel that we have coming up for you today is also kind of geared around to this work as well. So we will send out these slides with the links, but are there any questions before we jump into open hearing? All right, I'll pass it to Anna.
All right, thanks, Elena. Yeah, so in this part, we just kind of want to hear feedback from all of you on initiatives or events or exciting things that have happened so we can be a little more collaborative in our collaborative meeting here. So you can either put it in the chat or just come off. I'm going to try to see you all if I see somebody talking, but feel free to chime in, take yourself off mute. Anybody?
I'll go. The CAS Great Start Collaborative is planning a community resource forum in June 17th, and that we invite all service providers of all kinds to represent their agency. They get a 4-minute presentation. It will be on June 17th from 8 to noon. We will provide some food. It is in person, and it will be at the Pokagon Band Conference Center in Cass County. So if I will be giving out more information on that, but if you are interested in attending, I would say save the date, put it on your calendar, and join us, and let us know a little bit more about your agency, your services that you provide for families and children.
Great, thank you. So that was
I'm
Anna.
sorry, was
Carr-
that June 17th, that date?
Yes, that was June 17th.
Anna, do you mind just typing the event name again in the chat and the date? That way everybody has it and they know how to contact you if they need
Absolutely.
info. Thanks.
Hi, I am Janine Butler-Seitzma. I am the Director of Maternal Child Health at YWCA Kalamazoo. And we have some new events that are happening in our department. Unfortunately, right now, it's not open to the community other than our clients that are receiving services through WISH. That's Women Infant Supportive Health. So our goal is to help keep babies alive, to reduce the infant mortality rate, specifically among Black and brown babies. And so we've been doing that for quite a while, but we are beginning to celebrate those accomplishments. So on March 19, we will be having our first quarterly birthday celebration of the babies in our WISH program who are 1 to 4 years old. And we're pretty excited about that. We're collaborating with some other local organizations to help us to celebrate keeping these babies alive. So that's on March 19, I'm sorry. And this month, we also kicked off offering therapy through WISH to the clients of WISH. We have a licensed therapist, and we started this on the 1st of this month. And on the 2nd, we already had 8 referrals and had 8 people scheduled. So we see that the need is great, and we are excited to be able to meet that need within our organization.
Awesome. That sounds awesome. Thanks so much for sharing. That's great. Stephanie in the comments, Stephanie Zahn did say that in St. Joseph County, the Great Start Collaborative is hosting a Celebrating Babies event on April 30th from 9 a.m. to noon that's focused on bringing resources to pregnant moms and those parenting children under 1 year old. So we can connect with her. Thank you. And Anna put her stuff in the comments there too.
I wondered if I could share about the literacy hub work that's happening. I actually thought maybe I could share my screen for a second if that's not too complicated, Elena. So this region that we're all a part of here, and I know that there's sometimes a little confusion with a few counties that are sort of on the edge. So I might not be including everybody, but around the state, regions have been invited to participate in a literacy hub, a development of a literacy hub. So I'm working alongside with Anna and many other people on this call in all of the counties in the Southwest region to develop a literacy hub. And really our big focus has been around, I mean, we're still developing it, but it's going to really be around talking as teaching. And I'm sharing just a quick document so you can see some of the visuals, but I know Anna and I know Sherry's on this call, folks from Berrien and Van Buren and St. Joe. And I know I'm going to miss a few, Calhoun, Cass. So I apologize who I'm missing, but those of us in this region have been meeting pretty regularly.
Is Branch in there?
Branch, yes, branches. I don't think they're, yeah. Yes, Branch is in there. So it gets a little confusing. I wish the state would keep their regions together. But at any rate, I just wanted to share this visual with folks. You're going to start seeing more and more of this around the community if you're not already. In Kalamazoo County here, we're already in a lot of the pediatric offices at Bronson, and we've done lots of things around WIC, and we're building a partnership out with barbershops. So we're with the parks and recreation. Every county is doing it a little differently. We're all using the same visual, the same messaging about tuning in, talking more, and taking turns. And I know lots of folks think about that as, in terms of like kindergartners and preschool and kindergarten readiness, but really we're really focused on the babies as well and making sure families are feeling like they have the tools and the knowledge to just have those conversations with little ones. So yes, it's about reading books with our little ones, but really more importantly, it's about those conversations every single day, every single second, when we're putting a diaper on, when we're walking through the grocery store, anytime our little ones are close to us, and maybe I know I've done it, we hand them the phone and let them watch a quick video. If we can just have that conversation with them and talk about colors and talk about the shapes we're seeing, that's really what this initiative is about. So just kind of keep your eyes peeled, into that when you see it. We ask people about it. I know a lot of the preschools are doing a lot of work around it and some of the childcare centers. So it's going to look different in every county, but it's pretty exciting work. And it definitely overlaps a great deal with the pediatric and the OB offices, and just that conversation piece with families. So help us out when you can. If you've got a place that you would want to hang a poster or you'd want to put some materials out, let us know. And I can connect you to the folks in your county if they're not on this call, but just kind of keep your eyes peeled for that in the next year or so.
Love it. Thanks, Sarah. I really liked that marketing too. It was very accessible, looked good. So in the comments, Pam Ford put her email address and said there's a CPST classes that are in Cass County, June 27 through 30th, and in Jackson County, August 8 through 11. Berrien Springs has online breastfeeding support group. They meet the first and third Monday of the month. The meeting is led by an IBCLC and CLS. More info is on their Facebook page, the Berrien Springs Breastfeeding Support Group. Awesome. Let's see, Ben Buren is including talking as teaching materials on their infant outreach packs. Cool, that's awesome. Anybody else? All right, I'll pass it along to the panel. Thanks everyone for sharing.
Yes, thank you. And if you have other things that you think of, feel free to put them in the chat and we will send them out in the notes that recap the meeting. So we are going to jump into kind of the highlight of our meeting today, the COVID vaccination panel. So Sarah Drum is going to be our wonderful moderator, but I'm going to kick us off with some info and a video, just kind of as food for thought. So you heard me mention that SWMPQIC is using some of those immunization funds to get feedback from the community to better understand the current vaccination rates and opinions. So what we did is we sent out a survey and we got close to 90 participants who did the survey. That was a couple weeks ago, so the data is pretty fresh. And I just want to share with you a couple of the charts that we got back from that data. So this one question was asked, how has COVID impacted your life? And it was an option to select all that apply. So what we saw was that 27% of the people who completed that question on the survey said that their mental health was impacted by COVID. And so that's a pretty big chunk. Really closely following that, we saw that people said that their relationships with others also was impacted. So those two probably go pretty closely hand in hand with one another. Employment, physical health, and income also were greatly affected. And there was always an option for some others as well. And so things like childcare and death of families or friends were also kind of coming out in some of the other things. So we're definitely going to address mental health today in our panel as well. Another graph I'd love to show you from the survey is we asked, what are some things that you have heard about the COVID vaccine? Whether these things are true or false, or you are unsure of whether they're true and false. we want to hear what you've heard. And so this is kind of getting at some of those myths and rumors, but also some true things that come out as well. So we asked everyone to select all that applied. So the most common thing that people had heard is that rapid tests are less accurate than PCR tests. We also heard lots of people had heard that wearing masks are not an effective strategy to prevent getting COVID. COVID vaccines cause infertility. 14% of people said that they did hear that. Kids are less likely to get COVID. If I had COVID, then I don't need to get vaccinated. COVID vaccines aren't safe for pregnant women. And then also, if I'm up to date on my vaccines, I won't get COVID. There was also some others as well where people chimed in that certain vaccines were better than others, or they were leading to some long-term effects as well. So these things that we have heard, or a lot of you have heard, we're also going to talk about in our panel today with our providers. And then one other graph I really want to share with you all is what factors impacted your choice to get or not get the vaccine. And we asked again, select all that apply to you. So overall, the people who completed our survey, 21% said that the impact COVID has had on their family, friends, or community was really a factor that impacted them to either get or not get the vaccine. That was also 21% also talked about the data on COVID cases and infections, and the number of individuals that have already been vaccinated was an impact or a factor in their choice. Also closely following was information on education of vaccines on the news or social media, as well as through providers or doctors, and the unknown long-term effects of COVID or the vaccine itself. Fear of getting COVID or the vaccine, cultural, religious beliefs, and other also came out. A lot of things came up. Employment was one of them, and just kind of reiterating some other facts about the impacts of people around them that they have seen. What is interesting, and I'd like to highlight here, is that out of the 86 people who completed this question, incentives like gift cards and money, only 2 people said that that was a factor that impacted their choice. So very interesting, and can kind of help SWMPIC think through about what are those factors and opinions of others to kind of help us as we continue this work. So that's what we heard from our region. I would like to share now a video that was created by Region 9. So Region 9 is our region to the east. They created this video with people that shared their own testimonials. So one second. I'm going to share my sound. So we're going to watch this quick video. It's only 4 minutes, and then we will jump right into our panel with our own panelists.
I'm a healthcare worker. I saw the devastation that the disease can cause, and still when it was my turn to do it, I kind of, even a little part of me had a pause, just like, is this the right thing? Do we know enough?
The biggest concern was that it was new. I am a new parent, my husband is a new parent, and so even the regular like standard vaccines we were reading on.
And it was sort of a trust in the history of the vaccine technology, to know that, yeah, this is a vaccine to a new virus, but this vaccine technology itself is not new.
The selling point for me was that my daughter was going to receive some antibodies.
Antibodies were passed through the breast milk to the babies, and I was just thinking about, I want to do anything I can to protect him.
What's the one thing you can do as a new mom is for immune protection of everything, right? Cold, flu, anything, is breastfeed your baby.
Even though I got vaccinated while I was pregnant, it was in the 2nd trimester of pregnancy. We don't know how much of the immunity my daughter got by the time she was born. And then also if my immunity was waning, certainly the antibodies in the breast milk would be as well. So the booster was really important to me to protect myself and my family.
We know a lot now. We have a lot of good evidence to say that the vaccine is safe during pregnancy, and we could have spared them this infection during pregnancy. And so I always tell patients, you're weighing the risks they're talking about of the vaccine, not against no risk. That's not the equation. It's not vaccine risks or no risks. It's vaccine risks or risk of infection.
I know that being pregnant is scary in itself, and it's loaded with lots of worries of just trying to make sure you protect your baby, you know, while they're still in the womb and then when they're born. People can say that vaccinated people and unvaccinated people both can catch and carry COVID, which is true, but the chances of somebody getting COVID that's unvaccinated is just so much higher. And so with that, we decided that vaccinated family and friends are the safer bet for him. But not having been able to see our unvaccinated family members, it's taken a toll mentally on our whole family.
It's good to be able to mix and mingle with our family and friends who are vaccinated and kind of have that line of support, especially as new parents.
Who else were you trying to protect when you got the vaccine?
My sister.
Where is your sister? A baby, yeah.
The guilt has been lifted knowing that I am doing everything I can to be safe, and that makes me feel good.
And so I'm not going to say that a lot has changed, but the biggest thing for me was family and support and being able to have a birthday party for my daughter who just turned 1.
For me, it's just the added layer of safety and protection, less risk for hospitalization and death. I mean, that's the goal. I want to be alive to raise this kid, to raise a new baby, and I want him to be safe. You know, once it's safer, traveling probably, and getting back to life as normal.
I got vaccinated for my daughters.
I got vaccinated for my daughter, Eleanor.
I got vaccinated for my son.
I got vaccinated for my daughter.
So I want to thank Region 9 again for allowing us to share that video with all of you today. And if you want to learn more about the video and where it came from, you can either go to Region 9's website or you can email Helen Jo, and I will have her information in there as well. So it is her contact info is here, and the hyperlink to the region's website is also on the slide. So I will pass it over to our lovely moderator, Sarah, and have her get us kicked off with our panel.
Thank you, Elena. I appreciate that. Just want to go over a few things before we get started with the panelists, and I'll introduce them in a moment. The purpose of today's panel is to create a safe environment where health professionals will respectfully answer questions about COVID and COVID vaccines. Our hope is that anyone who's currently unsure about getting vaccinated will feel comfortable at the end of this discussion making a knowledgeable and informed decision for themselves and for their families, and that everyone will feel confident sharing what they learned here today with others. And in some of our conversations leading up to this with the steering committee, we've all been pretty honest that there's been a lot of confusion. Obviously, we're all still learning all the time. about COVID and in the impact and the vaccination. So we're really just hoping that everybody can leave this meeting just feeling more confident about the facts as we know it, and hearing from healthcare professionals who are in the field, who are working with families, who are studying the research. And then we can all go forward just feeling more confident with those conversations. A couple of ground rules is just that everyone is respectful to me, our moderator, our panelists, and our other meeting participants. We recognize that it's okay for others to have a perspective different from our own. We will keep the comments in the chat responses positive and respectful. And then questions for our panelists will be placed in the Q&A and proposed by the moderator. And I think that we're actually just going to put those in the chat. I think that'll work. So either one would work. And then if there's time, we have some questions here. And if there's time, we'll get to some of those questions from all of you. But I do want to remind you that all the questions that we're going to pose to the panelists today came from those 86 responses to those surveys. So we took a look at that. Elena did an amazing job of pulling all of that data together. And we tried to kind of pull out some of the themes or some of the questions that we kept seeing recurring over and over again. So these aren't just questions we came up with out of thin air. They came from those individuals around our community who participated in that survey. But we realized some other questions might come up, and we will do our best to get to those. I am going to also recommend, I saw that to just put something in the chat about turning off your camera and muting. Another thing that I think is sometimes helpful for something like this is if you want to just primarily see the speaker, you can point to view up in the upper right-hand corner and click on side-by-side speaker or the speaker, depending on how it shows up. And then you'll see the picture of whoever is doing the speaking, whichever panelist is speaking at that time. So I like that. For some reason, it just helps my brain to not see it in the little boxes. I'm going to take a moment to introduce everyone very briefly. They do have a more lengthy bio that will be included in the notes after this, but we wanted to just take as little time as possible and just get right into the questions. So we have Dr. Amanda Walker with us, and Dr. Walker is an OBGYN for Bronson's Women's Health. We have Sonia Dato-Sandhu, who is a certified nurse midwife at Bronson Women's Services. We have Dr. Karen Garcia, who's a pediatric hospitalist, certified lactation consultant for Bronson Healthcare. And we have Heather Keel, who is a perinatal mental health clinical therapist and a licensed medical social worker. If I said anyone's name wrong, I apologize, and I'd love for you to unmute and please correct me or say your name correctly. Okay, I hope I did okay. So we're going to just jump to panel questions. The first is a question that I'm addressed to all of you, and if you can just take 2 minutes to respond. And then moving forward, I'll kind of direct questions toward each of the panelists, so there's not that lull in the action of people wondering who's going to speak. So first question, just how has COVID impacted you and your patients or clients? Again, just if you can be thoughtful of time. We're going to just go how you appear on my screen. And so we'll go with Dr. Garcia, with Heather Keel, with Sonia Dato-Sandhu, and then with Dr. Walker, if that's an all right order. So just a few minutes to share how COVID has impacted you and your patients. Dr. Garcia.
I have to apologize in advance for my voice, but it's better than it was this morning. Yeah, COVID has definitely affected every single one of our families that we help take care of. I work primarily as a newborn hospitalist, both at Bronson, Kalamazoo, and Bronson Battle Creek. And I will have to say the thing that's been the most difficult is those separations of moms and babies. When we've had those very sick moms and stepping into a role that is not my usual, but being a sounding board for the family members that were not anticipating to be taking an infant home without the mother. And that's been hands down one of the most emotionally, I don't want to say draining because it's not a derogatory thing, but it's definitely the most emotionally intensive thing that I think I've had to do in my career.
Thank you. Thanks, Dr. Garcia. Heather, if you could go next, that would be great.
Sure. So for me personally, I'll share a little bit. My second child was born 12 days before the pandemic hit, before everything shut down. So this will be a bit of an interlacing between what it's been like for me as well as my patients, because I've seen a lot of that be echoed. After the pandemic hit and shut down, the hard lockdown happened. I had to essentially raise two kids. My oldest was 2.5 at the time, and a newborn, while my husband was going to work because he is essential. It really rocked our whole family. I mean, in immediate and extended. It was really kind of crazy because there was this shock that I think we're still kind of reeling from, with family members and friends who didn't feel the same way as we did. And it was frankly quite traumatic, thinking there's this virus out there that's, what is this going to do to us, to our kids? And that difference among relationships, whether it was intentional or not, it created this communication of, these people aren't valuing the safety of my newborn child, and talk about a mama bear complex that starts coming out, right? Like that was a big deal. And it essentially was very minimizing and took an already isolating time and made it even more so. The plan that I had made, my husband and I had made to have family come over and help and for my recovery, and it couldn't happen. It was all of a sudden just, nope, sorry. It felt like a life and death decision if somebody came over. And then the resistance or the minimizing from other family members really compounded the fear and anger and anxiety that I was already feeling. And that kind of segues into what I've seen with my patients, is that a lot of it's been echoed in that same respect. And like Dr. Garcia was saying, seeing these women and holding them and supporting them through being separated from their babies after they're born. In my practice, I don't know if I have ever done so much trauma work with women who are pregnant and then postpartum. Expectations have changed with what does prenatal care look like, in the sense of whether their partner can be there at the doctor's appointments, and who's available to come help postpartum, who can be in the labor and delivery room. So many women I've talked to that have said, I'm praying to God that I don't get COVID, or that my husband doesn't get COVID, or my partner doesn't get COVID before we deliver, because then that just seals the deal. So there's a lot of preemptive work that is being done, and then a lot of trauma work for what happens afterwards. And in a nutshell, that's what I'm seeing.
Thank you.
My name is Sonia, and I am a midwife at Bronson. And I think for me, on a personal level, what felt really challenging, and one of the uniting themes of this group, right, is that we want to keep the babies safe and we want families to thrive. And getting up and going to work, with my kids being home and everything being locked down, I was so scared that what I was doing for my job that I love to do was going to result in me getting my entire family sick. And that panic at the beginning of us really knowing so little about the virus. And so that just felt awful on a personal level, of being essential, of knowing how much I love my work and feeling like every day when I came home that I was potentially going to get my kids sick. And then the other piece too, particularly in office visits with pregnant people and families, was just this feeling, and I never have all the answers. And part of my job is to help facilitate what the best choice is for families, but I felt so completely lost on how to support the counseling or even support shared decision-making with families because I had such little information. So I was stressed out about being at work. I was stressed out about bringing home something to my family. And then I was stressed out at work that I wasn't doing what I needed to and wanted to do with families to be able to be supportive because everything was so new and we were getting information from all sorts of places. I think one of the hardest parts about modern parenting is maybe that there's too much information. And this was happening again with COVID. So it was, yeah, I mean, just all of that stress, and it has shifted. And I think we have a lot more information and a lot of good information to make positive decisions, but we're still kind of in that relentless information overload, constant risk assessment about basic things on how to be a community member and how to be a parent and how to be a healthcare provider.
Thank you.
I'm one of the OBs and I have the pleasure of working with Sonia and some other people on the call. I would echo all the things that have been said so far. So everything that we do has totally changed. How we provide care, how we interact with families, what birth looks like, who's there, how do they recover. Every part of this is different. And I think that the amount of overwhelming information that we're trying to sort through daily and rely on good resources and evidence-based medicine, we really strive to provide patients with all of the information so they can make an informed decision. It's been really challenging. And I think, part of the hardest thing of the work that we do is talking to families who have lost a baby, and to know that the reason for that is this virus has been very totally different. Never had to have conversations like this before, and it's been very different the way that we provide care. I think in personal and professional, all of it has been stressful in many different ways.
Thank you all for the work that you do, but also for just being really honest about the impact this has had on your work and then your families and yourselves. This first question is for Dr. Walker. Many participants who completed the survey noted that they have concerns on the long-term effects of getting a COVID vaccine, like heart damage and blood clots. What would you share with those who have concerns?
Yeah, I think this has come up so many times. This is probably one of the biggest fears for many of our patients that we're talking to. And I think the most important thing, I think it was briefly mentioned in the video, was the technology that was used for this COVID vaccine. So the mRNA vaccination is not new. So for years, we've been studying mRNA vaccines. So the rabies vaccine, the Zika vaccine, influenza vaccines. There's a lot of good evidence about mRNA vaccines. And so although this virus was new to us, the way in which the vaccine for COVID was created was not brand new. And so it felt like, especially initially, like, oh my goodness, this is totally brand new technology. Is this safe? What does it mean? But really it was based on many years of research and evidence related to other viruses and other vaccinations that we have. So I do think now, especially, we have many years of COVID-specific data for that vaccination, but we also had vaccination data from before for these other viruses that were created in a similar way. I think the other important thing to think about long-term is that, all adverse events for every vaccine are recorded in a very specific way. And so there was a lot of discussion, especially around the Johnson & Johnson vaccine, that causing blood clots, and it was halted for a moment so that could thoroughly be investigated and that everyone could be certain that it was safe. And so we continue to evaluate all the vaccines, not just COVID, and make sure that they continue to be safe for everyone that's getting them. So long-term, I haven't seen any evidence to suggest that this is not safe. And unfortunately, we do know that long-term COVID infection does have a lot of risks to our families. And so I think the vaccine is absolutely safe in the long term, again, based on the mRNA vaccines from before and all of the current vaccine data around COVID specifically.
Thank you. No, I can say that the way that you just explained that helps me to understand it way better, the mRNA vaccine. So this isn't the Sarah show, but I just feel like I appreciate the way that you made that very simple and succinct. So the next question is for Sonia. Should a woman who is pregnant get vaccinated or get a booster shot? If so, when in their pregnancy it's safe to do so?
Yeah, so we recommend, not just me and Dr. Walker at our practice, but overall, the recommendations from maternal fetal medicine specialists, obstetrician, gynecologists, midwives, and the CDC and WHO are for COVID vaccination for all pregnant people. And the safety that we've reviewed indicates that it's safe to do at any point in pregnancy. And with that mRNA vaccination technology, one of the questions that I've heard about that is, well, if my baby is developing, is there any risk that this vaccine could cause genetic issues? And the way that it works and the science behind it is that it doesn't change your genetics to receive an mRNA vaccination, and it doesn't change any genetics of the baby. So the recommendation is definitely to do it in pregnancy and breastfeeding immediately postpartum anytime. And the reasons that we feel like it's important to do is because what we see in pregnancies, we see pregnant people are more at risk of getting really sick from COVID. So what that means is if it's a mild COVID for a pregnant person, it might be more severe. They're at higher risk of coming into the hospital and having to be hospitalized. And they're at higher risk of having to go into the intensive care unit and have a ventilator, right? So a machine that breathes for you. So when we look at the increased risks in pregnancy, we're even more compelled to say, hey, this is really important to do in pregnancy, or ideally you've had access to it before you got pregnant. We are also seeing that we at this point have vaccinated hundreds of thousands of pregnant people. And so we're using all the information we have about how the vaccine has worked in those pregnant people to get a better sense of safety. So one of the things we see for safety is the things that normally can happen in pregnancy, complications like diabetes or high blood pressure or having a baby preterm too early or a baby too small, low birth weight babies. All of those things happen equally as commonly for a pregnant person with just in our normal data or a pregnant person who got the COVID vaccine. So we're not seeing things happen to the pregnancy because of getting the vaccination that we're worried about. We are, however, beyond just moms getting really sick, which is obviously really stressful, worrisome to mom and baby, traumatic from a mental health perspective, we're seeing some complications happen for the babies. And what we're seeing is perhaps some increased data on stillbirth and pregnancy, as well as preterm birth, so babies coming too early, as well as high blood pressure problems for mom, which also would mean that we might need to induce a baby earlier and might increase our C-section rate. So when I'm considering, right, like that we're all going at this for how do we keep ourselves safe and how do we keep our babies and our families safe, I really think that receiving the COVID vaccine overall really improves the safety for the mom and the baby in the pregnancy.
Just to clarify, when I might have misheard or wasn't, the complications that you're seeing for the baby and the mom, that's with that has nothing to do with the vaccine. That's people that get COVID or test positive.
Yes.
For COVID.
So the complications were all for people who have an active COVID infection during their pregnancy.
Okay, thank you. The next question we have is for Heather. Many survey participants noted that mental health and relationships with others have been affected by COVID. What would you suggest to those who experienced this, and what have you seen in your practice? And I know, Heather, in your introductory answer, you did talk a little bit about this impact on your own family, but maybe if you can dig into that a little bit more across your practice. Thank you.
Sure, yeah. So in terms of practice, what I primarily suggest is that first acknowledge and name how you're feeling with all of this. there has been all across my caseload and in patients that I've seen over the last 2 years, an overwhelming amount of relationship shifting. And it's difficult to name how you're feeling when it's someone that you didn't ever expect to be feeling this way with, right? Like my mom and I don't agree, or my sister and I don't agree. So acknowledge and name how you're feeling to yourself and to your partner, or to a primary support person. And then to practically speaking, don't be afraid to set boundaries, both physical and conversational. It's been echoed a lot that people are really tired of talking about it. It feels like a broken record. And so to not be afraid to set some conversational boundaries. And really that's for the sake of preservation of relationships that you want to keep. And spending time regularly checking in with yourself and with your immediate family, the decision makers of your household, and evaluate how you're feeling about the choices your family is making. And do we continue to stand by it? There's a ton of data that's regularly coming out, and not being afraid to say, okay, well, now that we have more information, we need to make different decisions. And this is, as a household, thinking about, moms and dads and decisions with their kiddos, continually going back and assessing, and are we feeling good about how we are making decisions related to COVID, and not being afraid to say, yeah, we have more information now. There were 2 years into this, we have more data. How we felt a year and a half ago might be totally different than how we feel now, and being open to just regularly checking in with that. The relationship piece, I think by and large has been the biggest stressor, because we talk about when a family has a baby, who's your village? It takes a village to raise a family. And this has been incredibly jarring for families that have not seen eye to eye. And so I recommend to my patients to find your support people that you do feel like you can be open and honest and transparent with, and set boundaries and be patient. I have a lot of clients who are talking about that they feel forgotten because their littles can't be vaccinated yet, because that's not, the under 5s aren't approved yet. So they're feeling very left out, very forgotten as the world's opening up, and feel like they're kind of a broken record talking with family members who maybe don't feel the same way, and saying, look, our kids are still not vaccinated. We're still not comfortable with this. And again, it feels very minimizing. I know I said that in my introductory, but it can feel very minimizing and internally upsetting. So practically speaking, setting boundaries is the biggest piece of advice that I give people. And don't hold back and be ashamed to say how you feel and name that, and take care of yourself and your needs for your family at the end of the day.
Thank you, Heather. Our next question is for Dr. Garcia. If someone gets vaccinated while breastfeeding or pregnant, will immunity pass to the baby? Will the baby still need to get the vaccine when it's available to them? And I know that video kind of started to speak to that, but if you could dig into that a little bit, I'd appreciate that.
Absolutely. Insofar as the transplacental immunity, we have lots of different research that's come out over the past couple of years, and it's been really fun to see that IgG, which is that long-term memory antibodies that we tend to make, are seen in cord blood samples when they have been checking them. So it's been very amazing to kind of see that, yeah, even while baby is in utero, if you get your vaccine, you're passing along that immunity to the baby. Granted, they're short acting. So usually within about 6 to 8 weeks, they start degrading, which is about that rate that we see in the first 6 to 9 months of life, that you're seeing babies are getting vaccines about every 8 weeks. And that's about as long as some of those short-term antibodies tend to last. And same thing as we've seen with breastfeeding, which again, as a huge breastfeeding advocate has been incredibly exciting to see. And even in some of the breastfeeding physician groups, it was one of the funnest things to see breastfeeding women and breastfeeding professional doctors who were testing their own breast milk as things came out, to see what it was that they got. And at least for the first 6 weeks after birth, we definitely are seeing a pretty robust transfer of IgA and IgG. So again, that long-term one, that IgA one tends to be more a secretory one, and it tends to degrade a little bit more in the baby's gut, which is why we were very, very excited that we're seeing more of that IgG that's passed along. And the other question that I've gotten is, well, if I had COVID, you know, like I'm probably going to be making antibodies, and that's just as protective for my baby. And one of the studies that they actually ended up doing showed that moms that had natural infection with COVID, the types of antibodies that they were actually excreting in their breast milk is predominantly that IgA, which is that one that I mentioned, is mostly that secretory and much more likely to be degraded in the gut. Whereas the mothers that have had the vaccine are secreting both and are predominantly the IgG type. I don't know if any of that made sense.
Well, I know it's new information to me, new language, new acronyms for me, but I think you did a great job of explaining it. Thank you. So the next question, open to putting this one out to Dr. Walker or Sonia, or maybe both of you can take a stab at it. Again, this has been talked about a little bit, but I know we kept seeing this question come back, is do COVID vaccines cause infertility, miscarriage, or birth defects? And how do we know?
I can start, and then Sonia help me out if I'm forgetting anything. So no, we're very confident that the COVID vaccine does not cause miscarriage, does not cause infertility, does not cause any birth defects. How we know, so I'll take each one of those. So miscarriage, you know, I think it's a really stressful, to put it mildly, emotional time for people. And the regular rate of miscarriage just in the general population was actually a little bit higher than the people who had the COVID vaccine. There's been several good studies that have come out that just compared pregnant people who had the COVID vaccine and those that didn't, and what the rate of miscarriage was. And it absolutely was not higher, in fact, was lower in those that had the COVID vaccine. So whether or not that's, you know, because of it, or, you know, I don't know that that's the cause, but anyway, it certainly is not higher. It was equal to or slightly lower in those that had the COVID vaccine. I think that the infertility question is really in the minds of a lot of people. Both, and how the rumor started was there is a placental protein that kind of mimics one of these parts of the vaccine. And so a couple people sort of grabbed onto that piece of information and made a link between, well, we see a similar thing in the vaccine as we see in this placental protein. And so that must be what the cause of infertility is, and kind of how all of this got started. But we now know that there is absolutely no link. Those are very different proteins, and there's no cause infertility for males or female patients that received the COVID vaccine. There's a lot of evidence on the Society for Reproductive Medicine, or ASRM, on their website, which is kind of where I send patients to that really want to learn more about this. Because again, I think, when you're trying to have a baby, fertility is trying so hard to do everything right, and you don't want to put anything into your body that may impact that in any way for either partner. And so this is also a really high stress time for people, and they're really trying to do the best thing to keep themselves safe and not have any long-term effects. But we now have hundreds of thousands of patients and lots of good evidence that there's absolutely no link to infertility for either person involved. Sonia, if you want to add.
Well, I think one of the benefits, I agree with Dr. Walker with all of what she said. One of the benefits we have right now is that we've had multiple years of time now in studying the vaccine. So I think now we're able to confidently look back and say, we have this group of people who received it and this group of people who didn't. And we really confidently can say that we are not seeing infertility issues or miscarriage issues or issues with birth defects. And so that's one of the benefits that I hope is reassuring to people who are still on the fence, is that we now have a lot more time in which we've studied both the vaccine and the complications from COVID. So just to reiterate all of the things that Dr. Walker said, and I agree, but I also just want to consider how much time we've had to look at it.
I think that's important. And I just have to share one of the things. This all started with stillbirth. Am I unmuted now? Sorry about that. Just wanted to share that we know people who have had COVID infection and pregnancy. We have tons of great evidence, not great evidence, but evidence that confirms COVID placentas are very different than regular placentas. And we think that that's the link with stillbirths and a lot of the losses that we've had for pregnant people who have gotten the COVID infection. And at Bronson, we have quite a bit of data ourselves. So, it's one thing to have national data, but we've unfortunately seen this locally. And this is a very real thing for pregnant people who have a COVID infection. There are very abnormal placental changes that cause quite a few problems with the pregnancy. Sonia mentioned some of those, but stillbirth is one of those. And the first time I had to talk to a family about that, I hoped would be the last. And this vaccine is what we have to reduce that risk.
Can I help real quick? One of the biggest statistics that really hit us as a newborn hospitalist team was one of the articles that just came out about 2 weeks ago, that the rate of stillbirths during the Delta wave to women who got COVID was 2.7%, whereas normally I think it's less than 0.8% that we anticipate stillbirths.
Well, thank you, all of you, for sharing that information. We continue to get a lot of the same kind of questions. And I think, we've got 64 people on this call around this region. So I think that information you're sharing hopefully can really help to lay some of those fears and to just get really positive quality information out to folks. This other question here is for you, Dr. Garcia, as well. If you don't mind tagging on to this, are children less likely to get COVID overall? Is the vaccine safe for kids? I know these are yes or no questions. If you can elaborate at all, and that would be helpful. We get a lot of questions about the under 5 group on this survey.
Absolutely. So the most interesting thing is how children were being represented in the testing samples. And when we kind of look back at how the pandemic has evolved and how restrictions have been lifted, we've actually seen the number of children being much more representative of the population of the US that are under 18 as time has gone by, because essentially at first what we were doing is we were staying home, schools were closed, there were no outdoor activities, there were no sports, there was no socialization. And so we had very little childhood cases. But as of just last month, the data that we have out, there's been over 12.6 million children that have been diagnosed with COVID. And of those, 1.26 have been hospitalized. And the big thing that I keep hearing is, oh, it's just those sick kids. But between 30 to 50% of those children that have been hospitalized, they've had absolutely no underlying medical conditions. So that's been the big fear. And as of a couple of weeks ago, or actually, I think it was just last week, the COVID-19 cases for under 18 is about 20.2% of all tests that are done. And in the US population, under 18 is about 22.2%. So it's definitely there. Kids are getting sick at the same rate as adults. It's just there was that lag because of how protected children were initially at the beginning of the pandemic. And then the big thing that we always get worried about is that multisystem inflammatory syndrome of children, or that MISC that you hear about. And at the moment, I think we're running close to 7,000 cases in the United States. And that's the scariest thing, is we don't have a really good grasp of why it happens. But the way that kids are presenting, it's absolutely terrifying. They come in fulminant sepsis. We've had kids that have come in with renal failure. We've had kids that have come in with congestive heart failure and myocarditis. And granted, a lot of them do great. We've only had about, I think it was a little bit more than 1,000 deaths in the US that are children. But those over 1,000 deaths mean everything to those parents and those families. So getting to the second half of the question is the vaccine safe? And so what we're showing is that at the moment, the side effects are pretty much the same with any other vaccine. The majority of what people are complaining about is pain at the site of injection. We're having some lymph node swelling and occasionally some fevers. It tends to be much more with the second shot than with the first shot. The myocarditis that was really worrisome, that again, everyone, kind of took a big pause and was looking in depth at that data, is very, very rare. We're only expecting 40 cases out of every 1 million doses administered. And when we actually look at the cases of that versus myocarditis with naturally acquired COVID infection, it's exponentially less. So the only people that we were particularly worried about was in men under the age of 30 that had their second vaccine. So when you look at the big data overall, that's not something that has been particularly worrisome to the medical community, because it hasn't been statistically concerning. Again, kind of going back to what Dr. Walker said, the big thing that we tend to hear is, oh my gosh, this is all new, like it's new data. But again, we have such long history of researching mRNA in particular. And so it's not new technology that we're using for these vaccines. And that's the biggest reassurance. So the difference in age groups. And with the kids that are 12 to 17 years of age, the efficacy has been fantastic. Even through the Omicron wave, more than 60% of severe illness, hospitalization has been reduced, which was wonderful. The 5 to 11 group, they only receive a third of the dose that the 12 to 17-year-olds get. And so what we ended up finding during the clinical trial phase is that vaccine was about 90 to 100% efficacy. But unfortunately, now that we're getting real-time data in real-world settings, we're finding that the immunity is actually waning after about 2 to 3 months. It's still highly protective against hospitalization and severe disease, but it's not quite as effective as the older age groups for catching COVID, period. And I have personal experience with that because my 6-year-old, who is fully immunized, he was one of the first kids in Calhoun County who got his vaccine, tested positive last Monday. And the amazing thing was I had my back-to-back study between my 6-year-old and my 4-year-old, who's unfortunately too young to get his vaccine. And Christopher was sniffly for maybe 48 hours, whereas Harrison is still hacking up a lung right now. So that's the biggest takeaway is, yes, the immunity is waiting earlier for that more robust protection against getting it, period. But it's still highly protective of severe disease and hospitalization.
Thank you. That is so much confusion around that, and to take that down by age group I think is really important. The other question, go ahead. Yeah.
I just realized I meant to mention the under 5 group and the big confusion that there was because Pfizer got this close to getting the emergency authorization. But what they did see is that the 2 vaccine series was not producing as robust of a response as those kids that were actually getting 3 vaccines. So they made a decision which makes sense, but is very frustrating to have to explain to people that don't understand the emergency use authorization process, that the reason that they held off is because they'd rather come out once and say, we need to do it in a set of 3 or in 2 at this dose, versus getting the emergency authorization and then a month later having to come back and say, and now you need to bring your child back for a 3rd dose. So that is the holdup with that. It's not because of safety concerns. It's more because we want to ensure what the full vaccination panel is going to look like for that age group.
Great. Yeah, thank you, Dr. Garcia, and all of you for doing all of the research and paying attention when some of us, can't decipher all of that. So I appreciate that a great deal. I'd love to encourage people to put a question in the chat if they have one. There are follow-up questions to something else that was asked, or maybe something that you were hoping was talked about today that we haven't gotten to. So go ahead and do that. Elena and I will be watching the chat and go through those questions as we have time. In the meantime, while we're waiting for some other ones to come in from the 66 people who are here with us today, we do have a few other questions that are coming up, and some of them are kind of predicting the future. So I don't know how much you know, but would ask anybody on the panel to answer or chime in if you'd like. Just wondering, and we heard from a lot of people that they're wondering, what do you think booster shots will look like in the future? Anybody wants to take their hand at fortune telling?
I mean, I think a lot of the information that is coming out, and this is so tricky because I feel like every time I gain a little bit of confidence about what things look like, we face a different variant or a different surge, and we're trying to figure that one out. But there has been a lot of discussion about, will COVID, instead of being a pandemic in the way that it is, be endemic, which is the public health word used for something that is just more common and kind of part of our normal day-to-day, like the flu. And so then will we be getting booster shots for COVID in the same way that we will be getting flu shots, or we will continue to recommend flu shots? And I think that's a theory that has kind of been put out there. But the other thing we need in this circumstance to figure it out is just time. And I'm happy if anyone else wanted to chime in or disagree, but that's kind of what I have been reading and seeing.
I think that's true, Sonia. I think, I sit on some COVID panels that has some experts that know a lot more science than myself. So infectious disease and some other colleagues that really can understand this data a lot in more depth than I can. And they have expressed a similar feeling, like we're talking about how do we make this transition from pandemic to endemic, as you explained really well, and what that looks like. Is it going to be a once a year thing? Is it going to be based on the timing of your last vaccine? I think the more that we know and the more time that goes by, we'll have a lot more data around that. But I agree that that's what it's looking like now, that it may become an annual or temporarily that way until we know more. That's kind of what it looks like so far.
Thank you. We did have one come in the chat, and I know it got touched on a little bit, but maybe if Sonia, you wanted to dig into it a little bit more, expand on it, or somebody else would, but it was, the question is, has there been a correlation or any linkage between moms who had COVID during pregnancy and higher rates of infant morbidity, low birth rate, or more illnesses early on? And I know, Sonia, you talked about it a little bit. If there's anything else you wanted to add to that, or anybody else has more to add to that.
So I don't have a lot of data in terms of like after baby's born, but one thing that I think we do know is that there has been a link to more preterm birth. And when we see babies that are born preterm, we know that earlier babies are going to struggle more with their development afterwards, right? They're going to be more of a compromised immune system, so it's harder for them to fight certain things off. They might be born smaller, so there's some issues with growth. So I'm wondering if like that correlation could theoretically be made, but I don't have a lot of good information with, I had COVID in pregnancy, my baby was born. Now, what are the effects on my baby's health afterwards? But I do think preterm birth is sometimes where that link comes into play, is those babies needed to cook a little longer, ideally.
I agree, at least from our standpoint, and helping supporting our families after the birth of a baby. We're seeing a lot more late pretermers, and we definitely see a lot more numbers of women who have had COVID during the pregnancy that have had late pretermers. And then the other one that we've seen have been what we consider small for gestational age, or those babies that are just smaller than what we expect for how many weeks old they are. And again, I kind of echo Sonia. I don't have great data to tell us, what that may potentially look like in 2, 4, 6 years once these kids start going to school. But at the moment, we definitely see at least that correlation.
I would agree with both of those statements. I would just add one other thing that I totally lost my train of thought. The things we know for sure are increased rate of stillbirth and our earlier born babies. And we know for sure that moms who have been vaccinated against COVID that also get a COVID infection don't have those same risks. So I've been asked that a lot too, like I've received my vaccine, but I tested positive for COVID. So what does that mean for me? And it means that those are not the same link. So it's only the unvaccinated pregnant people who get COVID infection that we're seeing these links. So if you are vaccinated and you also get COVID, we're not seeing those same early babies, smaller babies. We don't see that same link.
I want to jump in on that. Just to say, one of the questions I get pretty frequently in the office is like, particularly to the Omicron wave, when it felt like a lot of people were getting infected, was what is the point, right? Like if I'm going to get COVID anyway, what is the point of being vaccinated? And what Dr. Walker said is a really significant point, right? That the risks are really different, even if you do get COVID in your pregnancy, whether you've been vaccinated or not. And I think that's been when I think about this panel and the amount of data we're trying to share, it's hard to understand all of this stuff. It's hard for all of us to be up on it. It's hard for anyone in the community to be up on it. And so it's really hard to kind of have that disconnect of like, well, I know so many people who got vaccinated, but then they got COVID. But I think what we're trying to say is everything that we have is pointing towards that vaccination keeps you safer, your baby safer, even if you get COVID. And the other piece of the puzzle is that it keeps our community safer. So for those of us who do have kiddos who are younger than 5 years old, who can't get vaccinated, we know that the more people in our community who are vaccinated is just going to put a protective barrier around those families with little people in their homes, and around immunocompromised people. And I think that's just also kind of a consideration. We can talk about data all day long, but I also chose to get vaccinated because of the patients that I care for. And I think that community piece is pretty significant for vaccination as well.
I'll jump in here on the mental health side of things. Oh, sorry, Sarah.
No, go for it, Heather.
I cannot speak to the medical data as these lovely ladies have done such a great job with, but all of this to say, even pre-COVID, we know that stress has adverse outcomes in pregnancy and postpartum. And so the stress of all of this is not helping moms either. And so if they can get this information to put their mind at ease and to have these very informative conversations with their healthcare providers, that's going to tremendously help them on the emotional health side of things. And when mom is as minimally stressed as possible, that has better outcomes for mom and baby too. So just my little plug on the mental health piece.
Agreed. We had a kind of a comment and then a question. So this person said, the beginning of this presentation really humanized the medical professionals for me. Thank you so much for sharing. Also curious as to why you all might believe, why you are seeing so many medical professionals that are still not comfortable being vaccinated. So I'm sure those conversations are interesting within the medical world. That's open to whoever wants to respond to that.
I'm trying to remember what percentage of Bronson employees were vaccinated before the mandate, and it was pretty significant. So I hear this question and I struggle with it, but I think one of the issues is that those people seem to be louder perhaps than the rest of us. And because it is such a fringe opinion, I think it gets elevated on these pedestals where all of a sudden it becomes that this one physician or this one midwife or this one nurse has this feeling and they're in the healthcare world. And so we're going to give them a little bit more weight of their opinion. But at Bronson, we have a COVID mandate. And I will say we were close to, and I don't have this number in my head, close to like 90% of Bronson employees were vaccinated, I think, before we were even mandated. So if that's just a little sliver of information about our community and where most of us who work at this facility and have seen the poor outcomes, and in obstetrics, we've seen certain things, but also we have colleagues who work in the hospital floors and in the ICU and who have seen a significant amount of poor outcomes and death and family trauma from COVID. And all of us have seen that, and most of us chose to get vaccinated because of that. So I think the real world data kind of supports that. For whatever reason, there are still people who are choosing to use their position in the way that they are, but I think that we end up giving them a lot more weight than perhaps the other people.
I think that's true. I think our current number is up 99%. It's pretty close to that as far as vaccinated Bronson employees. So I think, like Sonia said, it initially, and everybody has mentioned, it took some time. Not everybody signed up for the very first dose because people wanted to look at the data and to take a minute to be sure. But once that came out, I think that trusting the science and relying on our colleagues and those that we trust and having honest conversations has really helped people to make an informed decision and make the best choice for their families. And I think that our percentage is extremely high of vaccinated.
Absolutely. I'll echo what Sonia and Dr. Walker just mentioned. And in November, before our mandate was officially rolled out for providers throughout the Bronson system, it was greater than, I think it was like 88 or 89% that had already finished their full vaccination series. And as of recently, it was like 99.9% that were vaccinated when we most recently had our med staff meeting. And I'll admit, I mean, I got vaccinated on the first day that Bronson had it available for employees, and I still remember bumping into Sonia in the hallway and going, "Okay, what do you know? What have I heard?" And exchanging that information just to I think we all have that fear, and we all kind of take that moment of processing, and some of us just need a little bit more of a moment than others. And there definitely is that added weight that's put on to people that are contrary to the majority, and that's why it seems so loud.
Great. I think, Elena, I'm kind of looking to you. Do we have time for one more question? I'm just going to put it out there and hopefully
Yeah, let's do one more.
Okay, great. Got a few more to choose from here. This one came in just a few minutes ago, but I know some of you did touch on that in your earlier conversations or give some of this information. So if somebody else wants to take a crack at it, or this person said, I was wondering if the pharmaceutical company has not developed a COVID shot for those 4 years and younger, why do we think the shot moms are taking are safe for unborn children and for those breastfeeding? So I know that someone alluded to, just the FDA process and how that applies to the 4 and unders, but if anybody else wants to chime in on this one, that would be great.
I guess I'll just echo again. The reason it hasn't been approved is not because of risks to the children. It's to ensure efficacy with how they're going to give the vaccine. So they think that a 3 vaccine series is going to work much better for that age group for efficacy against actually getting COVID. So that's that big difference. Insofar as safety, we've seen it. Our kids that are immunized, like for instance, take MISC, kids that have been vaccinated, their risk of developing MISC if they get COVID is dropped by more than 91%. So we know that safety is there. It's just in that smaller age group trying to figure out exactly, do we have the right dose, and is it going to be 2 shots or is it going to be 3 shots?
I think for people that don't do a lot of pediatrics, I remember it being one of the hardest things was the math involved. And so for small people, everything is dosed on weight. And I think that's something important for people to understand. And so when you're looking at a population that ranges from birth to 5 years old, that's a huge discrepancy. And so it's just taking a little bit longer to figure out what the right dose is to make sure that it's effective. But we were confident that it is safe. So just wanted to repeat that. And I think, again, for someone that doesn't do peds, it has a lot to do with weight. And I think that's part of the reason this group is such a struggle. 0 to 5, imagine how big your kids change and what their weight changes are. And so finding that sweet spot of an effective dose is a bit more challenging in that population. From my non-pediatric perspective, that's how it makes sense in my mind.
Dr. Walker, thank you for phrasing it that way, because as a pediatrician, I automatically do everything kilograms, milligrams per kilograms. And I guess the best analogy to that is there's a reason why you get Tylenol, children's Motrin, and for children under 5, call your pediatrician, and it's because we have to dose things by weight.
I, for one, feel like I've learned a lot about this kind of the process and the mRNA. If anybody has the answer real quick, just out of curiosity, of all the vaccinations that we give our little ones, how many of them are a 3-shot series or more? I don't remember. My kids are big now.
A lot of them. So, for instance, polio, pneumococcal, the rotavirus, the main ones that we get, we tend to have hepatitis B. We've got the series, they get the first hepatitis B vaccine after delivery, usually before they leave the hospital. You get 2 months shot, you get 4 months shot, you get 6 months shots, and those series are the same ones. Then you get them again at 1 year of age, and then you get them again at 4 years of age. So there's a lot of them actually that do require either 2 or 3 kind of loading doses to get. It's kind of like trying to turn on a car after it's sat out all winter. You got to crank it a couple times until finally that immune system starts making those long-term memory cells.
Well, thank you so much. I know we do have a few more questions, but we're going to end it for time for right now. And I believe I am supposed to hand it back to Elena, but before I do that, I just want to thank you all so much for sharing your time and your knowledge and for sharing your information in a way that is digestible for folks like myself and hopefully other people on the call. If people do have questions down the road, please reach out to, I think Elena is mainly your main contact because that's where you get the emails from, but we can try to circle back and see if we can get some of your questions answered. But again, thank you so much for taking the time to be here with us today. It has been very informative.
Yeah, so I just want to echo Sarah's thanks. So I appreciate all of you coming together and really answering those questions that we were seeing from our community that were asked within our survey, and then also from people who joined us today. I am actually going to pass it to Joy, who is going to close up our meeting today. And so she'll kind of give you the next steps before we head out, and you all get to join the rest of your day.
Awesome. Again, I don't think we can thank you all enough for being here. It was informative, and I think it's going to help with a lot of decision making moving forward. And again, thank you also to the panelists for their transparency and being able to answer these questions. If you all take a look at your screen, we have a QR code that's just going to be a quick evaluation for us. We'd like for you to just take a few brief moments to complete this. We truly value your feedback. We value the opinions and the different information you provide for us during and after these collaborative meetings. And by completing this survey, it kind of helps us to know, what did you truly think about this? And if there's something we need to continue to come back to, are there other topics or things we need to think about in the future that will help us as community, and specifically our mamas and our babies and our families here? So, and if you can't just access the QR code that's up on your screen, Elena has also put the link itself into the chat. So we do just want to end here again by thanking you, and asking that you just take a couple of minutes to complete the evaluation for us. And I think a few of us will be hanging out afterwards in case you guys just want to say some of your comments out loud, but we thank you for your time. And we will see you all at the next meeting and look forward to some communications coming from Elena.
Elena, is it okay if I stick around okay, so we can chat about the rest?
Yeah.
Okay.
Yep. If there's any Bronson employees who might be able to answer a question, if you would stick around for just a minute too, that would be helpful. All right, there's just a handful of us. Do you want to ask your question?
So my name is Keena King, and I work at the Barron County Health Department, and I work to reduce infant mortality in our county, and I work across our home visiting program.